Hi, this lecture is on health inequalities in people with developmental. To the PowerPoint display. The increases in life expectancy mean that people are living longer, but they're not living the lifespan as the rest of the population. And they have increased morbidity, that is, increased incidence of various health conditions. These include having hearing and vision impairment. So many people experience varying degrees of hearing problems right through to actual deafness, and varying degrees of vision impairment such that some people may be legally blind. They also experience quite high rates of severe epilepsy and also high rates of psychiatric disorder. Some psychiatric disorders such as depression and anxiety can population. They experience gastrointestinal problems like dysphagia, which is problems with eating and swallowing, H. pylori, which is a bacterial infection that causes gastroesophageal problems, and reflux. And many of these problems can go on for. If we look at specific types of disability, and we talk about comorbidity in the sense that people with Down syndrome are at much greater risk of particular problems. We know that they have intellectual disability, but they also experience congenital heart abnormalities. They have stomach or gastrointestinal, prone to respiratory infections, including acute and chronic otitis media. That is middle ear infections, and this is caused by just different shapes and relationships of the small bone, which chronic and repeat ear infections, and that from sleep apnea. As I mentioned with other people with disabilities, they can have vision and hearing problems. They can have hypothyroidism, diabetes, or issues with their hair. They can have. It's quite dry, so they can have a range of skin disease or experience problems with dermatitis. They tone, and this can result in problems because of such as in their hips and knees and their feet. Some may have atlaxial injury, and that there is a problem with the cervical section of their spine, which can lead to some serious problems in some individuals. They are at risk of particular types of psychiatric problems such as anxiety, depression, and obsessive compulsive disorder. And people with Down are at particular risk of Alzheimer's disease, which in the pre about ageing disability. Say that everyone would experience all of these problems. Is that require hypervigilant about these things, and certainly need to make sure that they have in place strategies. Comorbidities in cerebral palsy, just in this example, include musculoskeletal issues such as having weakness of muscles, stiffness and slowness in movement, experiencing pain, problems with their butts, are ambulatory, so will be in a wheelchair, and they may have involvements which can be distressing. So these sorts of problems can lead to strains, falls, and fracture osteoporosis. They can be at high risk for those. Their health inequalities also result determinants of health. That is, they tend to be at high risk of poverty. In fact, 80% of people with intellectual disabilities in developing countries, but even developed countries such as Australia, many will be on a disability pension or experience very low economic stability. Many will, as particularly people with more moderate to severe will have very limited networks. That is, their lives, maybe their family, and maybe paid support workers. And for some, most of their interactions are with. They are ready to in paid and meaningful employment. They might be involved in social enterprises, but in terms of open employment, it can be very difficult to get a job. With more end of the spectrum, or people with cerebral palsy, as we've experienced, do have communication issues, and this can cause a problem with them being able to explain and discomfort. So oftentimes may not do, or maybe misdiagnosed because they're not able to where it hurts, or problems in expressing or depression. So most of our problems aren't on people being taught, and communication problems are quite difficult. So we tend to look for behavioural indicators. That means looking at things that the person does or how they affect to be in order to detect that something is. Now, indicators can be in the noticeable behaviour in quite different things like injury or hitting, or they may lash out at other people, or they're quiet and disengaged and be difficult to involve in these sorts of activities that they usually enjoy. Just even getting your Centrelink. And the way we do that is through education, collaboration between people who understand disability because they work disability service professionals, through family members, and we'll work with them to help that service as reasonable adjustments. That is, the small things that mainstream account of the special needs of people with disabilities. Understands to some extent of physical access to people in wheelchairs. We all understand that a basic requirement, but we may not understand, or people in those services may not understand how to become communication accessible, for example, and that may simply mean having alternate ways of communicating to the person, or just being aware that people with disabilities will the time to allow, or to involve accompanying the providing multi, which you'll get to observe this week as part of your assignment, also improve, and that bring to the table expertise areas, can provide support to the whole team so that they can adjust to meet the needs of the person with disability. The other way we can strive for equality is to make sure that people with disabilities involved in making decisions, that they are engaged in self-determination to them involved in the decision. So think about when you go to a doctor, identifying plan, you have the opportunity to discuss whether or not work in terms of your role and your preferences. And if you have difficulty making that, they refer to your family or friends to help you in that. And people with developmental disabilities can be engaged in different types of supported decision making. So even people with quite significant communication disorders, for those individuals, we can rely on people in their support networks to come to a consensus as to what they believe the person would wish to happen in a situation. So after viewing this, you're going to return to the LMS and view some video clips, and I hope you enjoy the rest of the week's activities.